Hi, in this video we'd like to continue on our Hyperemesis gravidarum topic and the HG vaccine treatment that we do offer to all HG patients seeking a healthy, smooth pregnancy without hyperemesis. Now in this video we'd like to talk about an individual case basis where some patients may observe specific symptoms even after receiving our HG vaccine. Now these patients, before receiving the treatment, they are violently vomiting, excessive salivation, insomnia, mental instability, depression, and also the pre-existing complications, dehydrations. All the complications still exist, but upon receiving the treatment, you can see that the symptoms disappear very quickly within a few days when you are still receiving the treatment, and you will feel like immense relief. However, a small subset of patients, they will still experience something that is rather peculiar, which is they will observe an increased amount or significantly predominant symptom of just salivation. Now the vomiting is already ceased, the depression, the unhappiness, the headache, the vomiting has already ceased. Only one observable symptom is currently still existing, which is the excessive salivation. Now to explain this, many patients may firstly think that this is a side effect of the treatment, but it is not. The real reason why this is still happening is because we can deduce that the salivary glands of this type of patients have a significantly higher amount of these H2 receptors compared to other places that regulate sleep, that regulate nausea, vomiting, and also all the pre-existing conditions associated with HG. Now this patient, clearly she has hyperactive salivary glands that is binding with the HCG, which means the initial treatment that we gave her is still inadequate. It's not enough to actually cover up this salivary glands activity. She's still excessively salivating. However, it's nothing too serious because the vomiting has already ceased. That's the most important one. The headache, the constant nausea, all of that has already stopped. So the patient only observes the excessive salivation, but in fact her gastric secretions, her intestinal secretions, all of these are also significantly increased. They are also boosted, which means this will actually bring up digestive functions, making her appetite increase. This is another secondary observation that we can make if she still has this predominant excessive salivation symptom, which means she has a bigger appetite and she can take in more food. Now this is a juxtaposition where we can see before pregnancy, where she's still unable to take down any type of food before the treatment, but after treatment she can take up a lot of food, and this is actually beneficial to the pregnancy because the baby can grow big and healthy. However, if she's taking up too much food, then this could affect the baby's gestational size. The baby could be too massive, too large for a natural delivery to occur. This can affect your labor process. You might need a C-section. But for that, Antai Hospital does have a solution. We do offer you water births, a specialized labor treatment service that we do here at Antai Hospital. Now, we don't want to give this patient additional HG vaccine because she doesn't need it. The severe symptoms have already ceased. For this type of patient, because of just salivation, oral medication will suffice. So she needs to take oral medication as instructed by her doctors and nurses. Just take them regularly, and also if she takes this medication, she'll see the salivation drop, and once salivation drops, she will also observe appetite to begin to slowly drop as well, not too significantly, but she will it will be observable for her, and then this can actually affect the baby's gestational size. This can allow you to maybe make the difference between a natural delivery or a potential C-section. Of course, we do not want a C-section if it's unnecessary. This is just an individual case basis that some patients may observe. Not many will observe this, but if you do observe this, this is the protocol that we will give to these patients, which is just to follow oral medication until you see an observable decrease in your salivation and accompanied with your appetite. Now do consider Antai Hospital's water birth as well if you do want to engage in natural birth, especially for those who have a larger gestational size of their pregnancy. This can affect natural delivery that is not offered in other conventional hospitals. And for those HG sufferers, HG patients seeking a smooth, healthy pregnancy without the disturbances of hyperemesis, please get in touch with us via the website. Our HG vaccine is very effective and can guarantee a smooth, full-term pregnancy for you without the disturbances, the symptoms, the traumas of HG.